So let me call the Gloucester Board of Health meeting of Thursday, January 11th to order. We are in the Harbor Masters Conference Room, and this is a hybrid meeting. The public is welcome to attend this meeting in person. However, there's also a Zoom link to access the meeting remotely. Please note that the in-person meeting will not be suspended or terminated if technological problems interrupt the remote connection. So let's just go around the room introducing ourselves. Tori Philly, Board of Health member.
Mark Balzola, board member.
Joe Rosa, Chair. Kaplan, Vice Chair.
Dominic Curley, Director of Public Health.
Jacob Taylor, Food and Health Inspector.
Bree Turco, Health Inspector.
Chelsea Goldstein Welsh, Regional Prevention Director.
Leslie Whalen, Sanitarian.
Leo Leary, Financial Specialist.
Great, thank you all. Next item on the agenda is public oral communication. That's an opportunity for anyone in the public to discuss an item not on the agenda for up to 3 minutes.
I have one person with their hand raised.
Okay,
Please state your name for the record, please.
Good evening, Mary Ann Boucher, 93 Mount Pleasant Avenue. As of yesterday, many trucks were located all day and into the evening on Hart Street and East Main Street. And 3 reports of overflow on the website. What measure is the Board of Health taking to ensure residents who live on Hart Street, Bass Avenue, East Main Street, and adjacent streets that their properties are not subject to any such contamination? Have any tests been done? One resident I spoke with this afternoon is highly concerned for her property. Her property's water level was knee-deep. Her entire lot, yard, steps, and more were covered in this water. She has concerns for her family and her 2 dogs. And I'd like to know where the city stands with the ongoing contamination issues that were brought forth over a year ago. Where are the updates on all of this? How is this going to be resolved? When is it going to be resolved? Thank you.
thank you. We can't really discuss the issue right now because it's not on the agenda, but I can say that this clearly is of some importance to the department and the board. But regarding the solution, it's really, I believe, a DPW issue. Have you mentioned it at all to those at DPW?
Well,
Marianne?
I brought it to the attention of the city council, who was supposed to bring it forth to DPW. But this is a health issue as well, Mr. Rosa. And I don't understand how we can go this long without concerns from your department and you and your department bringing this forward to the DPW and city council. I know this one person that I speak of Hart Street, she told me that the DPW was going to conduct some tests a few months back, and they never did. And, you know, just as everything else, if you don't talk about it, it suddenly disappears, right? So we haven't talked about it for a long time. And so it has disappeared again. But with yesterday's or day before yesterday's storm, and seeing so many trucks for so many hours back and forth, we know that there's a real issue there. And it's time for our city to maybe use some of the 23 million to take care of this problem once and for all before you've got a lawsuit on your hands. There's contamination everywhere. We know it. We've seen it. It's been tested. It's been in your data, and it's time. It's long overdue. Thank you so much.
Thank you. The department, the board and the department will certainly look into what we can do. Certainly, as you mentioned, talking to the city council is one thing to do, or DPW, in fact. But I would encourage you to do the same. I've heard you say that you've already done that, but if you're not getting sufficient activity, I would do it again. Thank you. Next, I presume there's no one else?
No one
to
else.
speak. Next item on the agenda is the approval of the December 14th, 2023 minutes.
Will we accept the minutes?
Of December 14th, yes.
December 14th?
Second. Is there any discussion, amendments, changes?
I voting on if I wasn't here.
Okay, we still will have a quorum to vote. So let's go around the room and with votes.
Thor, yes.
Marco abstains as he wasn't here for that meeting. Joe Rosa, yes.
Eric, yes.
The meeting minutes of December 14th are approved as written. Next item on the agenda are committee reports. Dominique, I'll let you
Sure.
orchestrate how
Sure.
that happens.
Why don't we start with Jake Taylor?
Jake Taylor, Health and Food Inspector. The month of December, we had one foodborne complaint, 26 inspections, 2 inspections due to violation, and 3 events. I just want to say we made it through every inspection for the 2023 year, days, nights, weekends, got them all done. So that was big. We had the lobster trap tree lighting, the Middle Street walk, and a half marathon, Christmas marathon, all with hot drinks and snacks for the general public. So that was about it for me this month.
Thank you.
Bree Turco, Health Inspector. I did 12 rental units in December. We only had 3 complaints. So down a little bit, 2 of them were housing complaints with 1 re-inspection. And getting through those.
Q.
Hello, Leslie Whalen, Title V Sanitarian. This month, I wanted to tell you about a subdivision at Cole Ave. This came to our attention many months ago. The septic subcommittee heard them and we sent their stormwater plans out for review with New England Civil Engineers. Their report came back to us in October, and we shared it with the applicant and said that we wanted to discuss it at our November subcommittee meeting. And the applicant said, we'd like a continuance. So now we've had several months of meetings and we haven't addressed this issue. But the planning board has a plan before them, and the applicant has now gone back to the planning board. They were with them last week and presumably will be again next week. So I think it's time that we take the report that we received from our outside consultant, New England Civil Engineer, and write a letter to or a memo to the planning board saying that we do not recommend that the planning board approve this subdivision for the reasons outlined in that report. And the main one is the stormwater drainage system would discharge to the zone A of a surface water supply. And that is a reason for the Board of Health to say, we do not believe this is a good subdivision.
Because, and without me putting words in your mouth, but I believe for the board's benefit, that would require a variance. This is new construction, and our policy has been in the past that we don't allow variances for new construction.
So there is a variance request that they've made. And that's why we looked at the stormwater under the Massachusetts standards and hired this outside consultant to look at it. But they were actually asking for a variance from our local
Sure.
standards. So it's possible that we deny that variance and then they meet that standard, potentially, because that's a different standard. So regardless of whether we give the variance that they requested, we have this other very wide track of boards of health review subdivisions. And when they say we do not recommend them for reasons just like this, the planning board will deny it. But
Good,
we have to
good.
put this memo in their hands.
Good.
So,
So you have both of those bullets in your armament, as it were.
yes.
So that's good. Thank you.
So, would you like to vote on this simply because the planning board may say, well, Leslie, your staff, normally we hear from the board. So if you wanted to vote and say, yes, we give you the thumbs up, that would help sort of close the loop. But I can still write the memo from staff.
So this would be coming from the septic review subcommittee. Is that-
Actually, it would just come from me at this point because we don't have another meeting until the end of February.
Okay, since it's not on the agenda.
Yeah,
I
we don't want to
would-
vote. Okay,
We shouldn't vote on it.
okay.
But you, from my perspective, other board members can chime in. From my perspective, having you send the memo is fine.
Okay. Thank you.
Thank you, Leslie. Appreciate that. So from a director's update standpoint, before we get to Chelsea, if that's all right, I just wanted to give you all a few updates. One is that we have hired our assistant director. So her name is Gabby White, and she is currently a senior inspector in the town of Concord, Massachusetts. Where you hailed from back in the day. She's been there for quite a while, overseeing inspectional services of surrounding all the work that we were just talking about. And I'm really excited to have her come in and lead this team. So she'll starting on the 29th, and we're really pleased to have her be a part of the team. I also wanted to let you know we're still searching for a public health nurse. We're getting a little creative about how we're recruiting at this point, reaching out to the citizens of Gloucester to talk to those that they know who are RNs and who have an interest in this area, because we really need it's a very important position for the department, and there's a lot to do. I also want to sadly announce that Lee is leaving us. She's going to join the treasurer's office, and so this will be her last board meeting. And so I just want to say thank you, Lee, for all the work that you've done. I know I've only worked with you for a short while, but you've been in the department for so long, and I'll wish Lee well. And we'll still see her, of course, in the treasurer's office, but she won't be part of our organization anymore.
Thank you.
Yes, thank you, Lee.
Thank you, Lee.
And the final thing I just wanted to bring up, and we can talk about this in a future meeting, is we want these meetings to be as effective as possible and make sure that the board is getting the information that they need from everybody. And so I'd like to add as an agenda item for our next meeting, perhaps an open discussion about, what we might want to add to these meetings, enhance these meetings, what other things you might be wondering about, so that we can make this as effective as possible briefing for the board and the decision-making body that it's designed to be. So we can add that to the agenda next time, I hope. Right, and I'm gonna be covering Cindy later on. Do you want me to just do Cindy, or Chelsea, would you like to go?
You can go ahead.
I'll keep going, okay.
Wonderful.
Cindy's on holiday, so I'm going to be covering, you all had the information that she gave you, which was, pretty much through the end of the year. The rates for COVID continue to rise. I think our positivity rate at this point is 11.7%. We're still tracking a little bit behind the state, but not by much. Things are spiking pretty heavily. Over nationwide, we have over a 20% increase in hospital admissions. In the last month, 12% increase in ER, 12.5 increase in death from COVID. So it is on the rise. I'm hearing a lot of anecdotal about it. Important to understand, if we're looking at positivity rates or incidence of COVID, those are obviously a smaller number than what's actually out there, because a lot of people aren't going to the doctor. They're just sort of pushing through it. Equally important to understand is the influenza rates are also rising pretty dramatically. And we're seeing, we were just speaking about this right before the meeting started, that there's some pretty, significant influenza A is having some pretty big impact on folks. So what we'd like to just remind the citizenry of our city is if you are ill, please try and stay home, stay away from folks. If you are immunocompromised or over a certain age or have health conditions that you consider wearing a mask when you're in closed locations. And certainly washing your hands is a really important thing as well. That's important for us all to do to sort of keep this at bay and keep us all as healthy as possible. The other thing I wanted to let you all know is that I think we talked about it last time, that the CDC called an emergency meeting, Mass DPH gave a presentation on hepatitis A, sort of on the rise. And we are hosting a vaccination clinic at the Grace Center on February 13th. And we're hoping that we can help to vaccinate a lot of our folks that might be at risk for contracting hepatitis A in that effort. I also reached out to Cindy to find out if we have another flu clinic coming up. I'm sorry, I don't have that date. I'm pretty sure we have another one scheduled, but I don't have that date for you. If anybody's interested in influenza vaccines, they can certainly reach out to the health department and we can set up and schedule appointments. We have vaccines on hand. And so with that, I will turn the tables back over to Chelsea to catch us up on the prevention side of the house.
All right. I have listed in the board packet a number of different programs that we've been working on and that we have coming up. I'm going to highlight a few of them, and then if you have any questions about anything in particular, I'm happy to expand on anything I have in the report. We are a team of three, myself, David Tucker, our youth development coordinator, and Dan Liebert, our prevention coordinator. We've been super busy this week facilitating meetings in a box at the Gloucester Middle and High Schools. This is part of the city's comprehensive plan for the next 10 years. And so in order to solicit feedback from residents, the city, came to our prevention team as part of the health department to help solicit that input from the young people in our community. So we are very grateful to the Gloucester Public Schools for working closely with us and allowing us to come into their schools and meet with their students directly to solicit those feedbacks and facilitate those discussions. So we went into every 8th grade civics class at O'Malley Middle School, about 200 students in 10 different civics classes this week to facilitate the hour-long meetings. And the kids had fantastic feedback, like really thoughtful. Some of it was like, Chick-fil-A, which is important. And it was also, things as thoughtful as we need to ensure that events that we hold in the city are accessible to people with disabilities. So like really thoughtful ideas and engaging conversations with the kids. We also held a meeting in a box for high school students during their homeroom on Wednesday, and 27 students elected to join. So that was out of their own choice to come and join us for that conversation. That was a really engaging conversation. So we're exhausted from being with middle schoolers all week, but we met with 227 students and got feedback from all of them, which will be given to the consultants and to the community development department to be incorporated into the feedback from all of the other residents from across the community. So we're super excited. We're really proud of our Gloucester youth leaders from our Gloucester Youth Leadership Council. They were a huge part of this process. We engaged them in the planning process, and we had our high school youth leaders help to lead the discussion with their peers during the Wednesday meeting. So we're super proud of our youth leaders, and we're hoping that this will be an opportunity to get the word out to more students who are maybe interested in joining as well. So we're hoping we'll get some new recruits. In addition to that, we've been very busy again with Gloucester Youth Leadership Council. Over the winter vacation, they volunteered at the Rose Baker Senior Center, helping with some classes with the older adults and helping to organize the bookshelves at the center. Our North Shore Youth Leaders, which is our high school group that is regional, they're actually meeting right now. That's where David Tucker is. They have been meeting to plan an event for this upcoming spring. We're thinking it's gonna be another North Shore Teen Summer Send-Off event with a focus on promoting mental health for youth. So they're planning for that, and they're also working on a Fent Alert Challenge through SAMHSA, which is the Substance Abuse and Mental Health Services Administration. It's a peer-to-peer challenge that encourages youth to educate their peers by either creating a video or some kind of media to educate peers about fentanyl. And for us in particular, we're thinking really about the prevalence of fentanyl-laced marijuana and how that is a thing, and many kids don't even know about that. So really both fentanyl in pills and fentanyl in marijuana. So that group of North Shore youth leaders is working on creating a video that they'll submit as part of that national challenge. So we're really excited. Couple more things, just again, working with young people. We're running an after-school program through O'Malley Academy this winter. We're running a bowling club at Cape Ann Lanes, and we're very grateful to Cape Ann Transportation Authority for providing us an in-kind donation of a bus. So they're providing a bus to transport the kids from the middle school to Cape Ann Lanes. And that is just, again, it's a donation, and we're really honored to be working with them and very grateful to them. Lastly, I'll say Cindy Junker and I have been working to enroll the Gloucester Health Department in the community naloxone program. So we as the health department are an official, we are officially registered as a location for the community naloxone program. So we are allowed to distribute naloxone to the public. So we see this as complementing the work that One Stop Harm Reduction Center does. They are the harm reduction specialists in the community who are able to train people and distribute naloxone. And we are just one additional location in the community to reduce barriers to access. So anyone who is interested in obtaining naloxone, which is also called, some people refer to it as Narcan, they can access that at the health department and get that free of charge. And we'll be able to provide it and then also give them a quick tutorial on how to use it. So we're very excited. And that is it. That's it for me.
Thank you, Chelsea. We were working with Cindy earlier in the month, and Cindy gave us all a refresher on first aid and Narcan administration, as well as obviously CPR and choking management. So that was a nice session for us to all refresh. I think all of us had been trained in the past, with the exception of one individual, but it was always great to get that refresher. So that was a good thing for us to do. I also just want to take a moment to just call out the whole team here, because Jake said, oh, I finished all my inspections, but realize what that means, that he had, despite all of the 400 events that went on last year, he also had all of his inspections across all of our food establishments. So that was a huge amount of work for one person to tackle. Rosalina Castro stepped up for some of our home kitchens as well at the very end to help us out. And I appreciate that. And Jake just really a fantastic job making that happen. It was a lot of hard work. So I really appreciate that. Bree gives these small numbers, but with every single thing she does, there's countless meetings and coordination across the city. City departments with our legal teams, with citizens in the city. And she is forever poring over law to make sure that what we're doing is compliant and good. And she's very diligent about that. So it's incredible. Chelsea and her team have, she talks about this meeting in a box that took hours of planning and coordination, and her team took it very seriously. And it was one of our first moments where we were really working hand in hand with the schools. And so not to be underplayed, in addition to all of the other work that they're doing across the communities. And Leslie, I continue to learn more and more. I actually went out on a site visit with Leslie for one of the septic systems that are going in over on the western side of the city. And her work too is very complex, and she takes it very seriously and has just a lot on her plate. So we're a small but mighty team and getting a lot done. And Lee, of course, who will be leaving us, very hard to replace, has really just takes care of all of the administrative obligations and all of our marketing as well. So she has been going above and beyond for quite a while. So this is an incredible team, and I just wanted to make sure you guys all heard that, because it's just awesome to work with you all. So.
You're here.
Appreciate
Thank you
all
all.
Thank you. Vacation in February.
Well deserved.
Something to look forward to.
Yeah, I guess so.
So, the last item on the agenda, I believe, are concerns of the board. One concern I have that Mary Ann raised actually is that it would be useful to be able to respond to people about responsibilities. Because she's absolutely, the public would say this, and Mary Ann explicitly said it, that, you know, gee, this sounds like a health problem. But my sense is that water quality and sewerage treatment, stormwater treatment, those physical structures are dealt with by the state, not by us. So it'd be, if we could at next meeting, have a firm description of what we can do and can't do. I mean, we can make noise. But it would, if we can't do more than that, it would be useful for the public to be aware of where the responsibilities lie.
Absolutely.
Agreed.
I suspect that if we were checking the Good Harbor Beach canal right now, with all this water we've had, it probably would be failing.
Oh, for sure,
Suspect.
but, you know, it's not beach season, so that's not what we do.
No. But I keep thinking about it. I mean, we had a flood in Rocky Neck.
Oh, yeah, no, I mean, the combined
Streets are totally-
sewer overflow is
Yeah.
happening. I mean, the harbor is
I mean,
being
this is all climate change stuff. and
Yeah. dumped into, yeah, well.
It's only gonna get
lots of-
worse.
Lots of rain, exactly. Exactly.
So,
So anyway, it would be useful for us,
Okay.
for the city to understand where responsibilities lie so that citizenry can contact the appropriate people.
Absolutely. I'll make sure we deliver that in our next meeting, and and we'll add that as an agenda item.
Sure.
Okay.
Anything else, you guys? Don't have anything? Motion to adjourn?
so moved.
Second.
All in favor?
Oh, yes. Marco, yes.
Joe Rosa, yes.
Eric, yes.
We are adjourned.
Boy, that was amazing.
Jake had it
Yeah,
just
right on
about
the
spot
nose.
on.
We got it. With